or impossible to apply through an exposure suit. As soon as you're able, and while doing the above, you should be towing the victim to safety. Again, use common sense and good judgment. If help's immediately at hand, emergency care may begin and be more effective with many people helping. Shock management is the final primary assessment step. The previous steps have helped minimize shock. After getting the diver into a safe environment and assuring breathing, circulation, and control of bleeding, continue with shock management as you learned in the Emergency First Response course. Shock, which may be characterized by shallow, rapid breathing, clammy skin, weak, rapid heartbeat, restlessness, and anxiety and confusion, is possible after any injury specific to diving. Keep the patient lying down. In some climates, you may have to cut an exposure suit off a weak patient to prevent overheating or overchilling. You begin a secondary assessment only after determining that no immediately life-threatening conditions exist. If necessary, contact emergency medical care or send someone to do so. Keep the injured diver in the position you found him and examine him as you've learned, looking for deformities and pain. An exposure suit may interfere with a secondary assessment, but if you suspect neck or back injury, you shouldn't try to remove it. Instead, immobilize the diver's head, just as you would in any other suspected back or spine injury situation. It may be necessary to cut the suit away to prevent overheating while waiting for EMS. If there's no reason to suspect neck or spine injury, you can begin first aid for any injuries found during secondary assessment. Monitor the patient's lifeline until emergency care arrives. Although underwater problems like running out of air are obvious and dramatic, many are more subtle. Watch for trouble signs like hard, rapid breathing and inefficient, awkward kicking. Dog paddling with the hands usually indicates a diver's struggling. A panicked diver underwater may have wide eyes. He tends to be vertical in the water, breathing heavily just before bolting for the surface using his hands in a desperate dog paddle. Although rare, a panicked diver may lapse into passive panic, characterized by a near trance-like state. Such a diver may be totally unaware that you're there or what you're doing to help. How you help with an underwater problem varies with the problem and circumstances. Have an overexerting diver stop and rest, ideally hanging on to something stationary. A properly weighted recreational diver in a wetsuit should not have an uncontrolled descent, even with a failed BCD. But it can happen with a flooded dry suit or if a diver's overweighted. Often, all you need to do is signal the diver to adjust his buoyancy. If necessary, though, make contact and arrest the descent by adding air to your or his BCD. You may need to surface to correct the cause. The opposite problem, an underweighted diver, will only have more difficulty as the dive progresses as his tank gets lighter. Help the diver control his ascent, surface, and adjust the weight. Losing weights, a stuck inflator valve on a BCD or dry suit, or improper dry suit techniques can cause a runaway ascent. Make contact and deflate the diver's BCD or dry suit by the quick exhaust valve. Disconnect the inflator hose if it's stuck. If you can't stop or control the ascent, let go and signal the diver to flare out and slow the ascent with drag. Surface at a safe rate if necessary to check on the diver's condition, but don't risk getting hurt too, or you won't be able to help. The most common cramp in diving is in the calf. Help the affected diver by holding her fin tip so she can push against it to stretch the muscle. Gently massage the muscle and give it a chance to rest before moving on again at a slower pace. Entanglement and entrapment can occur, but are relatively rare. In both cases, first have the diver stop everything. Your first concern is to assure the victim has enough air while trying to free the diver. Assuming adequate air supply, have an entangled diver hold still while you slowly disentangle her. Use a cutting tool with great care, only if it's obvious the disentanglement isn't working or will take too long. If you suspect passive panic, confirm by signaling "OK" and checking for response. If the diver doesn't respond, take him to the surface holding his regulator in place. Be cautious because a diver in passive panic can go to active panic without warning. At the surface, establish buoyancy and tow the diver to safety. With active panic underwater, your primary concern is to prevent a rapid, breath-holding ascent. With a breathing, panicked diver, simply slowing the ascent is your best bet for controlling the rate and getting her to breathe. With an out-of-air, panicked diver, delaying the ascent may be enough to get her to take your alternate air source. Assume that a panicked diver without her regulator is holding her breath. If she won't take your alternate, you may have to push it into her mouth while gently pushing the purge to keep it clear. Even if she begins breathing, the panicked diver will likely continue her rush to the surface, so flare to control the ascent. At the surface, establish buoyancy for the victim and calm her down. Stay close and assess the diver for lung overexpansion injuries or other problems that may require further attention and care. A missing diver is a potentially serious situation because if the victim is underwater and not breathing. Permanent brain damage can occur after about 6 minutes. Time is critical, and the conservative course is to assume the worst until you can account for the diver. How you respond will depend on the environment and resources you have at hand. When it's apparent that a diver's missing, follow these steps as best you can. Have someone contact emergency medical services or other appropriate authority while you find out where the diver was last seen. Assign people to watch for bubbles and try to determine if the diver may have left the area without telling anyone. If available, immediately assign qualified diver teams to gear up for an underwater search. In clear water and good conditions, send out a snorkeling team because they can enter the water and search faster from the surface. When conducting a search, start where the diver was seen last. Descend without swimming so you drift the same way an unresponsive diver would. Random searching is slower and less effective than a methodical search. There are 4 patterns commonly used to look for missing divers. The first is the U-pattern search, which allows you to cover a large area with only a compass. It's a good choice when you have several search teams covering different parts of a large area. The expanding square is a good choice when you have only one search team. It's effective in moderate visibility and on irregular bottoms, and you need only a compass. It's most useful when you believe the missing diver isn't far from the start point. A circular search allows you to search a large area rapidly in poor visibility. However, it requires a line and reel and doesn't work well when there are many obstructions on the bottom. The surface-led search requires a boat or snorkeler, a line, and several divers who are familiar with it. But it lets you search a large area of relatively shallow water quickly, with the boat or snorkeler controlling the pattern. When searching for a missing diver, keep these considerations in mind. Permit searches only in buddy teams, making sure searchers have ample air and no decompression time. Don't let searchers jeopardize themselves. Assign someone to keep track of the search teams so they don't get forgotten when the victim comes out of the water. If possible, establish a way to recall the searchers when the diver is found. This is especially important on a boat if the boat must leave to get the victim to emergency care. If there's no way to have a recall, set a time for all searchers to surface and check for your signal to come in. If you don't have qualified divers present to search, you may have to choose a buddy and do it yourself. Search until you find the missing diver, until you reach an air, depth, or no decompression limit, or for no more than 30 minutes. After 30 minutes, discontinue the search and turn it over to professionals.
You've learned a good bit about the mental state of accident victims, but in Section 4, you'll look at some of the psychological effects handling an emergency can have on you. Next, this section gets into the nature of pressure-related injuries and the specific first aid for them, as well as for near-drowning patients. Finally, you'll learn the specific techniques for emergencies with unresponsive divers at the surface, underwater, and considerations about equipment removal. Any rescuer or witness who's involved with a serious accident or emergency may experience critical incident stress in its aftermath. It is an acute mental stress that impairs or overcomes someone's ability to cope emotionally and is most likely if the patient ended up permanently disabled or dead. Critical incident stress can occur immediately or sometime after the accident, with signs and symptoms including confusion, restlessness, denial, guilt or depression, anger, and anxiety. It can cause behavioral changes that affect mood, appetite, personal interactions, and cause sleeplessness or nightmares. If you experience critical incident stress, don't leave it untreated. Professional counseling helps those with critical incident stress learn to understand and cope with their feelings so they don't become lasting emotional problems. Many of the medical emergencies you might face as a rescue diver are the same as those in all walks of life. But diving also presents a risk of pressure-related injury. As you probably recall, decompression sickness is a pressure-related injury caused by excess nitrogen gas dissolved into body tissues due to pressure at depth. Upon ascent, the dissolved nitrogen dissolves out of the tissues into the lungs. But if dissolved nitrogen exceeds certain limits, it may form bubbles in the tissues that cause decompression sickness by blocking blood flow and causing other damage. Lung overexpansion injuries result when divers hold their breath during ascent. Expanding air in the lungs causes lung rupture, resulting in air entering the bloodstream as bubbles. These bubbles block blood flow and cause damage by depriving tissues of oxygen they need. In the field, it's often difficult to distinguish whether a patient has decompression sickness or lung overexpansion injury. Since the first aid is the same, however, it's not important. Therefore, with respect to emergency protocols in the field, the specific cause isn't important, and you refer to both conditions together as decompression illness. Decompression illness symptoms include pain in the joints, fatigue, dizziness, extreme fatigue, paralysis, unconsciousness, cardiac arrest, and nausea. Lung overexpansion injuries result when scuba divers ascend holding their breath, or, though it's uncommon, when trapping blocks of air in a portion of the lungs. There are 4 possible lung overexpansion injuries. The first and most serious is air embolism, also called arterial gas embolism. This occurs when expanding air forces its way through the lungs into the surrounding capillaries, with the resulting bubbles flowing to the heart and rest of the body. If bubbles go to the brain, which they commonly do, they block blood flow and cause stroke-like symptoms. However, the bubbles can cause serious damage wherever they go. If expanding air forces its way between the lung and chest wall, it may collapse the lung. This is called pneumothorax and is characterized by severe chest pain and breathing difficulties. Expanding air can also find its way into the chest cavity between the lungs, causing mediastinal emphysema. This causes difficulty breathing, fainting, shock, and cyanosis, which is blueness in the skin. Expanding air can travel up through the chest and accumulate under the skin around the neck and collarbone. This is called subcutaneous emphysema, which can cause neck swelling, voice changes, and difficulty swallowing. More than one of the lung overexpansion injuries can happen at once, and all are considered serious conditions demanding prompt first aid and emergency medical care. You begin care for a diver with suspected decompression illness, DCI for short, with a primary assessment just as you would any patient. The priorities remain airway, breathing, and circulation. Assume an unresponsive diver has DCI, but give priority to airway, rescue breathing, and CPR if needed. Keep the patient lying down. Field experience has shown that symptoms may worsen in DCI patients who sit or stand. Refer to the flowchart on Diving Accident Management Workslate for the steps in providing DCI care. The specific first aid for DCI is emergency oxygen. Have a breathing patient breathe 100% oxygen from a non-resuscitator demand valve emergency oxygen system. Give a non-breathing patient oxygenated air with the unit's free flow setting. You'll practice oxygen system use in Rescue Exercise 9, and you can learn more in the PADI Emergency Oxygen Provider course. Protect the patient from excessive heat or cold, monitor his lifeline, and treat for shock while arranging for emergency medical care. Drowning occurs when someone suffocates from being underwater and cannot be revived. Near drowning occurs when the victim can be revived. Near drowning can result from exhaustion, panic, or other causes in water. Begin with primary assessment and rescue breathing if necessary, regardless of the time the victim's been underwater. A breathing patient may have shortness of breath, coughing, or convulsions. Administer emergency oxygen and get the patient into emergency medical care. Note that even a patient who appears fully recovered needs medical examination to prevent possible complications that can arise several hours later. Let's look at the specific techniques for an unresponsive diver at the surface. Approach any apparently unresponsive diver splashing or yelling to get her attention. Make contact and confirm unresponsiveness. Turn a face-down diver face up. You can do this by crossing your arms and grabbing his wrists like this. Drop the victim's weights and your own to assure buoyancy, and call for help if possible. Remove the victim's mask and regulator, and your own if necessary, and open the airway by lifting the chin and tilting the head. Look, listen, and feel for breathing for 10 seconds. Although it's rare in dive circumstances, if you suspect neck injury, open the airway with the chin lift alone, tilting the head only if it's necessary to open the airway. If the diver's breathing, begin towing to safety while monitoring breathing and protecting the airway from splashes. If the diver's not breathing, give 2 slow rescue breaths and then begin towing to safety, giving a breath every 5 seconds. If you miss a breath for any reason, resume with 2 slow breaths. If your rescue breaths cause the diver to begin breathing, proceed as above for a breathing victim. If not, estimate how far you are from surface support. If you can reach shore or a boat can reach you in less than 5 minutes, continue providing rescue breaths while towing the victim. Get the diver out of the water, perform a heart check and primary assessment, and continue with rescue breathing, CPR, or both as necessary. If you're more than 5 minutes from safety, provide rescue breaths for an additional minute to 2 minutes, checking for any movement or response to your breaths. If the victim responds but doesn't breathe spontaneously, continue rescue breathing while towing the victim to safety. If the victim doesn't respond, cardiac arrest is likely. Discontinue rescue breathing and tow to safety as quickly as possible for a primary assessment and to begin CPR as needed. In handling unresponsive diver emergencies, don't neglect your own safety. Consider the environment and circumstances. You want to begin rescue breaths if needed as soon as possible, but it may be necessary to tow the victim away from a hazard as quickly as possible before beginning. You will learn and practice 3 techniques for in-water rescue breathing: mouth-to-pocket mask, mouth-to-mouth, and mouth-to-snorkel. Mouth-to-pocket mask is probably the most effective in-water rescue breathing method, and has the added benefit of reducing disease transmission risk. Pull out your pocket mask as you approach the victim. After confirming the need for rescue breathing, move above the victim. Place the mask on the diver's face with your fingers under the jawbone and your thumbs on top. Draw the head back to open the airway and give 2 slow rescue breaths. Tow the diver to safety while giving a rescue breath every 5 seconds, monitoring for breathing and protecting the airway. If you don't have a pocket mask, you'll use mouth-to-mouth rescue breathing. At the diver's side, open the airway by running your arm closest to his feet, under his arm, and up behind to grab and support the head by the hood, BCD, or hair. With the other hand, pinch the nose and press down on the forehead. Use the underside arm to roll the diver toward you for a mouth-to-mouth seal. This is called the do-si-do method. Give 2 slow rescue breaths, then tow to boat or shore, giving a breath every 5 seconds, checking for breathing and protecting the airway. If you're significantly smaller than the victim, or when wearing heavy exposure suits like dry suits, the head cradle position may be more effective. The drawback is it's not as easy to roll the diver to you, so you may have to rise above the victim to give each breath. This is more tiring, and you have to be careful not to push him underwater. Another